1. Tell us about yourself and why aged care. Why it's asked, universal opener for aged care roles.
Model answer. I'm a registered nurse with _years experience across acute and long-term care. I'm drawn to aged care because it's relationship-based nursing, supporting dignity, comfort, independence, and quality of life over time. I'm confident in assessment, medication safety, escalation, and leading care plans with a multidisciplinary team.
2. Why do you want to work in this facility, Australia/New Zealand?
Model answer. I'm looking for a service that values person-centered, evidence-based care and strong clinical governance. I'm motivated by improving resident outcomes, comfort, mobility, nutrition, cognition, and prevention of avoidable deterioration, while working respectfully with families and the wider team.
3. Explain person-centered care in aged care. This is one of the most repeated aged care interview topics.
Model answer. Person-centered care means each resident's preferences, life history, culture, and goals guide the care plan. I involve the resident in decisions, support independence, and adapt routines, sleep, meals, hygiene, activities, to what matters to them, while ensuring safety and clinical standards.
4. How do you manage residents with dementia? Commonly asked in aged care interviews.
Model answer. I use a calm approach, simple language, and consistent routines. I assess triggers, pain, infection, constipation, hunger, overstimulation, and use non-pharmacological strategies first: reassurance, validation, redirection, meaningful activity. I document patterns and collaborate with the GP and family on the least restrictive plan.
5. What would you do if a resident becomes agitated or aggressive? Repeated dementia/memory care interview theme.
Model answer. I prioritize safety, maintain distance, use a calm tone, remove triggers, and call for support early. I avoid confrontation, validate emotions, and redirect to a safe, quiet space. Then I assess causes, pain, delirium, medication effects, and escalate clinically. I document objectively and update the behavior support plan.
6. What would you do if a resident falls? A top scenario question in aged care.
Model answer, stepwise. Stay with the resident, call for help, assess ABCs and injuries, check neuro observations if head injury suspected, monitor pain, and follow local escalation pathways, GP/ambulance. I document, complete.
7. How do you prioritize when you have many residents and tasks? Frequently listed.
Model answer. I prioritize by risk and acuity: airway/breathing/circulation issues, acute deterioration, uncontrolled pain, post-fall reviews, time-critical medications, insulin, antibiotics. I delegate appropriately to ENs/PCAs, communicate clearly, and reassess priorities throughout the shift.
8. How do you manage medication safely in aged care? Common, hard question in aged care guides.
Model answer. I follow the rights of medication administration, confirm allergies, check indications and parameters, and monitor for adverse effects, especially with polypharmacy. I escalate unclear orders, document accurately, and support medication reviews for high-risk meds, sedatives, anticoagulants.
9. How do you handle a resident who refuses care or medication? Frequently asked scenario.
Model answer. I explore the reason without pressure: fear, pain, misunderstanding, cultural preference. I explain benefits/risks in simple terms, offer choices, and try again later if appropriate. I respect autonomy, assess capacity.
10. What is your approach to end-of-life/palliative care? Aged care staple question.
Model answer. My focus is comfort, dignity, and honoring the resident's wishes. I monitor symptoms, pain, dyspnea, agitation, implement anticipatory meds as ordered, maintain mouth/skin care, and communicate regularly with family. I work within the
11. How do you handle family complaints or difficult conversations? Commonly listed.
Model answer. I listen actively, acknowledge concerns, clarify facts, and explain the plan clearly without defensiveness. I document, involve the senior nurse/manager when needed, and follow complaints processes. I aim for transparency and partnership while
12. Tell me about a time you handled a challenging situation with an older person. This is explicitly featured as a common aged care interview question.
Model answer, star. Situation. Task. Action. Result. Example, agitation, refusal, wandering, pressure injury risk, complex family conflict, show calm approach, assessment, teamwork, outcome. Sanctuary recruitment +1.
13. How do you prevent pressure injuries and other common aged care complications? Highly expected even if not asked exactly this way.
Model answer. I use risk screening, repositioning schedules, skin checks, continence care, nutrition/hydration support, appropriate support surfaces, and early escalation for redness or skin breakdown. I educate carers and document consistently so prevention is a team routine.
14. Describe how you work with the multidisciplinary team. Common across aged care interviews.
Model answer. I collaborate with GPs, physio, OT, dietitians, pharmacy, and carers. I contribute assessments and observations, support care conferences, and ensure care plans are updated and communicated. Good teamwork prevents deterioration and improves quality of life.
15. What do you know about aged care standards and compliance in Australia/New Zealand? This question appears explicitly in aged care interview resources.
Model answer. I understand aged care is highly regulated and focused on resident dignity, safety, and outcomes. In practice, that means accurate documentation, person-centered care planning, medication safety, incident reporting, and continuous quality improvement. I align my daily work with policies, audits, and clinical governance expectations.
16. Why should we hire you?
Model answer. I bring safe clinical practice, calm communication, strong documentation, and genuine commitment to older people's well-being. I'm confident with deterioration recognition, dementia support, family communication, and team leadership, while always maintaining dignity and resident choice.